Greetings from Apollo Hospitals, Grims Road, Chennai. One of the commonest rhythm disorder in the world today is atrial fibrillation. In atrial fibrillation, the upper chamber of the heart beats at the rate of 400 to 600 beats per minute, which usually patients come to us and with the symptoms of palpitation or fluttering sensation in the chest associated with breathlessness, dizziness, chest discomfort. Sometimes they come to the emergency with the sudden onset of palpitation and breathlessness. Some patients, it lasts for only few minutes to few hours. Sometimes it doesn't stop. They have to come to the hospital emergency to get the first aid treatment. If they neglect it, they don't pay attention to this palpitation, that can lead to stroke. Because the heart is beating at this faster manner, it does not effectively pump the blood. So the blood stays and then it forms a clot that can go to the brain, can cause embolic stroke. Sometimes the fast heart rate can lead to heart failure and they come to us with the swelling and sudden onset breathlessness. They land into emergency and as well as the ICU treatment. When you talk about the treatment for this common rhythm disorder, there are two ways of managing it. We first try to give medication. First medication is to prevent the stroke, blood thinners, and then to maintain the rhythm, that is to maintain the normal heart rate, we give antiarrhythmic drugs. Unfortunately, the efficacy of the antiarrhythmic drugs is only 40 to 50% of the time. Even the most efficacious drug used in the world today can cause potential side effects like thyroid, liver and lung damages can happen when you try to take long term. Significant number of patients, instead of taking this powerful medication, they continue to feel palpitation and then they repeated hospitalization and their quality of life is compromised very badly. For them, one of the main treatment today is interventional treatment that is called CryoBalloon Ablation. As I told you, this is one of the commonest rhythm disorder. There are many patients, those who have hypertension, diabetes, obesity, obstructive sleep apnea, lung related problems or old heart attack patients, bypass surgery patients. Those patients are prone to develop this sort of rhythm disorders. When they are already taking multiple medications, when these add to this antiarrhythmic medications to control the rhythm, still if they are not getting better, you know that the quality of life getting compromised very badly. So we generally recommend them to go for an interventional treatment that is called CryoBalloon Ablation, wherein we put the balloon inside the heart from the groin region and take it to the left side of the left upper chamber that is called left auricle and try to inflate the balloon and deliver the nitrous oxide, which cools the temperature to the minus 50 degrees Celsius and kills the cells, which is creating this sort of rhythm disorder that is atrial fibrillation. So by doing this procedure, which takes 1 hour time under short anesthesia, and it gives relief of 80 to 85% of the time. So it is almost double the success rate of medications. When they continue to take milder medications, which doesn't have much toxic effect, the success rate goes up to 90%. So this is a big boon to the patient, those who are suffering recurrent episodes of palpitation and hospitalization, not getting control with the routine medications. They don't want to take any powerful medications to avoid side effects. For them, this is the best treatment options, and then they can go home very next day and then lead their normal life.